Morning viewers, today we're talking about fingers, and in this week we'll be talking about fingers and toes. So bunions, osteoarthritis of the fingers, broken fingers, dislocated fingers. So if you've got any of those or friends that have had broken fingers and dislocated fingers, send them the videos or send them the link, subscribe and like, and let's see what we can do. So today we're going to be talking specifically about osteoarthritis of the fingers. And I've got this little magic massager. It's a reflexology for the fingers, and you can get it from Palooza's. I know that's where one of the companies that does sell it is Palooza's. It's a wonderful little shop in Irene village, or Irene area. So have a look, see on Google where it is, Palooza's, and they sell these reflexology finger massagers. So the nice thing is, because it can stretch to all capacities, it can stretch and fit over any fingers. You can even use this for your toes. So if you've got arthritis in your toes, you usually get it more in the fingers. But if you've got sore toes or you've broken your finger, this is an old fractured finger of mine, I would use it to massage the finger after a fracture, and you can sit at home and do it yourself. You need to wait 6 weeks for the fracture to heal before you start massaging the finger with this little gadget, because you need the bone to have grown on first, otherwise it'll be too painful and can cause more problems. So you'd massage the finger. You can see I'm just rolling it literally up and down and up and down. It will help for your swelling in your fingers. And this one was a finger that was dislocated. I wish I'd found this before I had known about, well, before I had these problems. So I've only recently found this little gadget. And you'd rub it over your joints that's been dislocated or your fat joints that are a problem. So with the osteoarthritis, you'll find that you get nodules on the side of the finger. Now, I've just started with one because we do have osteoarthritis in the family, but it'll make like a little knob, and then it'll be quite painful. So that you'd need to massage, and the longer you leave your knob, the bigger it gets, and then it starts pushing your finger skew, like the picture I'm going to have on my front of this video, so that you can see that the finger is skew, and so it starts pushing your fingers skew, and then you get like zigzag fingers. So you would take your little massager, as you can see I've got it over here, and you would just roll it up and down over the joint area to massage that area. And then you do it a couple of rolls over that finger joint, and then a couple of rolls over the next finger joint, because the arthritis is going to land up getting all your fingers. All right, so it usually starts off with your index finger and sometimes your pinky, but it doesn't matter which finger it is that's got the nodule on. You're going to do all your fingers. So you would just take it out, you would do the next finger, and you focus over the joint areas. It's actually quite a nice feeling. And then you do the next area. If you've got any swelling in your fingers as a result of, like I said, the broken fingers or a dislocated finger, you would then use it over the bits that are swollen, because it helps to soften the swelling up and make it more, it increases the blood circulation. Your fingers feel quite nice when they've been massaged. It increases the blood circulation. So you would just, as you can see, roll it up and down, roll it up and down. I'm going to do my thumb last. You can even do your thumb. Very, very nice little gadget that you have here to massage your hands. So you do yourself a favor, go to Palooza's, get your own little massage gadget. I've gotten 2 of my patients already that have been complaining of finger pain, and you know, it's sometimes it's not something that you want to necessarily go to the doctor for, and that because it's a little finger. But if you leave it, it can worsen, and then you'll land up, like I said, with skew fingers. So it starts pulling your fingers skew, because the ligaments are over this area here. Interesting fact is, you've got no muscles in your fingers. These are all tendons that run along here. The muscles originate from your forearm. But we need to reduce the crystal formation over your fingers that then cause the swelling or the nodules, and then that pulls your fingers skew because you're trying to get away from the pain. But because it's now out of alignment, it actually causes more pain and more nodule formation. So you take this in the beginning. If you've got big nodules and they're very painful, be gentle, don't overdo it, because your fingers might be very sore the next day or straight after. But the more frequently you do this must be like a daily routine that you set up. You can sit and do it while you're watching TV, you know, when you've got a few minutes, like now with me. Then you sit and you massage your fingers and get it going. So again, this is the little gadget that you're going to get. It stretches so that it fits all sizes of fingers. It's got a whole bunch of little wires that are like a triangles that are mix matched all the way around. and it's a reflexology, finger reflexology. So very, very nice to use. And then you'll find that when you're finished, your fingers will move better. You might even be able to use it to a degree for trigger fingers, although the trigger finger is more in the palm and coming more from the forearm. Have a look for that video. I do have a video on trigger fingers. It might not be up yet, but I'll post it up as part of our videos for this week that we are doing. So it's going to be fingers and toes, so bunions, osteoarthritis, dislocated fingers, fractured fingers, and trigger fingers. If you're interested in those, have a look over the next week or two as we post a video on Monday, Wednesday, and Friday. Have a great day. Thanks for watching. Bye.